Welcome back to Re-Energizing Tips and Tools for Mamas. My name is Walsh, and my guest today is Shawn Yakimovich, who is a naturopathic doctor right here in Kemptville. His practice is called Kemptville Naturopathic Clinic, and he is in the medical building on Van Buren. I imagine, Shawn, with COVID and back to school, that you are a very busy man. So I appreciate you taking some time with me today. So
Thanks for having me, Anne.
Yeah, I'm happy to have you. Tell me how long have you been a naturopathic doctor?
I think I'm completing my 14th year in practice. So I graduated 2006 and started practice November 1st, 2006. So
and
yes.
Do you have a specialty?
So currently in naturopathic profession, so officially no. My practice is a general family practice, so see all sorts of conditions, all ages. But personally, I have a personal interest in infectious disease treatment and prevention, especially.
Okay. How interesting!
Yes.
That you are interested in. So what led you, before we get specific, what led you to this career path?
Well, I have to credit my mother because growing up, she was always into, things like vitamins and back in the 70s and 80s before it was, mainstream at all. So if I'd have a cold or a cough, she'd give me a cup of tea with some leaves floating in it. Say, here, drink this, it's colt's foot. It's good for your cough. Or steam inhalation for a sinus congestion or things like that. I was always exposed to other practitioners like, chiropractic from a young age, things like that. And, always thought it was cool. It always helped me. And then as I got older, I just thought, hey, that's, I sort of felt a calling to the healing profession. And when I discovered naturopathic medicine and kind of the job description all under one, it was like, wow, I want to do that.
Yeah.
So that was in 1994 when I met my first naturopathic doctor. And then from that point on, my last year of high school, it was just focused. This is what I wanted to be. So it took a while to get there, but it's been fantastic. I love it.
Yes, that's amazing that a lot of people don't know what they want to do. So it's great that you knew exactly what you wanted to do. 2020 has been stressful for most families. What are some of the effects of chronic stress?
Well, in 14 years of practice, I've come up with a saying that stress ruins everything. So whatever condition you're susceptible to, so whether it's eczema or digestive problems or migraines, if we add chronic stress, it's going to make it worse, right? It's going to aggravate those symptoms. You're going to have a flare of, whatever the weakness is. But, common symptoms are insomnia, there can be weight gain, there's carbohydrate craving, obviously mood swings, irritability, just feeling frazzled. A lot of people suffer from like tightness in the chest. So it's kind of, with anxiety and panic. And, the list goes on and on. So, and then of course, the longer it goes, it's just, the worse these things can get. So, but again, in 14 years of practice, I would say maybe close to 80% of the patients I see have chronic stress as an underlying cause for the symptoms they're coming in with. So when I do the analysis and the interview and you get right down and you find out about their life, it's like, wow, there's, been a lot of stress either in the past or currently ongoing or often both. And it's just, stuck in that loop and they're starting to feel it physically or emotionally or both.
Yeah, that's kind of sad, actually. 80%. That's a lot.
Yeah, that's an estimate, but it's I would say chronic, chronic stress or stress or trauma. You know, it's kind of a spectrum, but yeah, it's, you know, once, you know, I have the luxury of time with people, so I can spend up to 2 hours for the initial visit. So there's time to get into things, and yeah, it's there. It's all around us.
So,
you know, yeah, it goes deep and it's widespread.
yes. Here's something that I've been curious about. A few years ago, I kept seeing adrenal fatigue. I kept hearing about it. It was very trendy. And some of the stuff I read was like, it doesn't even exist. And other stuff I read was like, oh yes, this is something that's affecting a lot of people. So my question to you is, does it exist? And if not, what are we actually seeing that we're calling adrenal fatigue?
Right. So adrenal fatigue, it, you know, no, it doesn't exist. It's not really a medical entity. It's like a, I guess, a pop culture phrase.
Yeah.
But what it's, you know, what people are trying to say with that is they're trying to encapsulate kind of all the chronic effects of ongoing stress. So back in the 50s and 60s, there was a Canadian scientist named Hans Selye, and he sort of elucidated what we call the general adaptation syndrome, right? So all mammals, when we're stressed and put under stress, there's kind of 3 stages we go through. So first, there's like what's called the alarm phase, right? So a stress occurs, we rise to the challenge. You know, adrenal glands are spewing out adrenaline, cortisol, right? There's this whole cascade of chemicals that flood through our body. So we meet that stress in the short term. And then if the stress continues, we adapt. So we kind of go on cruising altitude here and can sort of plow through it, right? And so that could be 2 weeks, it could be 2 months, it could be a decade or more even, right? If things are constant, we sort of plow through. But eventually there's a decline, which is called the exhaustion phase, right? So that means, you know, there's changes. So it's not that the adrenals fail and fatigue per se, but our body switches. So we either become less sensitive to the hormones that are coming out of the adrenals, and so things don't respond in the same way, or the adrenals are kind of you know, down regulated in order to preserve function, because you know, if that continues, we start to break down, right? So the body's always trying to balance. But, you know, one of the major, I guess, symptoms of long-term stress is obviously just feeling burnt out, right? So you're fatigued, you're tired. And I think last year, the phrase burnout was actually officially recognized as like a diagnosis. So, you know, I would say that's all sort of part of this. So whatever term, you know, you use, that's kind of, you know, actually what's happening here.
Wow.
So, yeah. And I mean, so yes, it's not that the adrenals fail, but there can be changes in our cortisol production, and, you know, that can be overactive, it can be sort of downregulated. And then normally our cortisol follows a circadian rhythm, so sort of a daily rhythm where it's highest at about 8 in the morning, and then it kind of does this gentle like ski slope towards bedtime. So it's gradually falling through the day. That's the normal curve. But again, in the milieu of chronic stress, that can sort of spike at 3 in the morning, right? And side effect of chronic stress is people wake up at 3 in the morning, the mind is racing, and you can't get back to sleep till 5 or 6 or ever for the rest of the night. It's because cortisol's spiking 5 hours too soon, right? Your body's in sort of fight or flight mode, in action mode. It wants to get going. But then down the road, the body can sort of try to compensate and kind of flatten that curve. And then you're just sort of tired all the time.
Yeah.
So
hence the popularity of coffee in the morning. You see the lineup.
Well, yes. And that's a sure, you know, a sure sign. If you need coffee to like just get functional, then there's,
I heard,
there's a need
not
for
that
some
I need it at all, but I heard some people.
So I've heard.
Yeah. So anybody listening to this, what can they expect if they book a consultation with you?
So yeah, so the first, I mean, under normal circumstances, so my initial adult consultation is 2 hours. And so generally that's 90 minutes. Well, first of all, I send you a fairly lengthy health history questionnaire. So it's very thorough. So that's filled in and submitted even before we talk. And then that's my jump off point, but that's where people can list, all their health concerns, whether it's one thing or 6 things, medications, supplements, but we go through everything. There's a whole review of systems there. And then I ask even more questions when we actually start the interview. So normally it would be maybe 90 minutes of interview and then some physical exam that's relevant to the person. If it was an inpatient visit, certainly since COVID, I'm doing more virtual care. So which can be appropriate. So we don't always get to the physical exam part, but still, right, the interview is fairly lengthy. And then at the end of that first session, I generally have a good sense of, what's going on. And one of the principles in naturopathic medicine is treat the cause, right? So whether it's a rash or digestive issues or headaches, we always want to see, can we figure out why this is happening? Yes, we want to get rid of the pain or the skin eruption, but can we go back a step and say, okay, is it a dietary issue? Is it stress? Is it some environmental trigger? So we're always trying to, investigate that. But by the end of the first visit, I always, start the ball rolling with treatment recommendations, whether it's, diet changes or lifestyle or, some herbal medicines to strengthen organ systems, or whatever. So
Yeah, I appreciate that. That's one of the reasons that I love naturopathic medicine, because you go to your regular doctor, your whatever physician, and the first thing is like, okay, what's going on? Why are you here? And then, oh, okay, and then you see them scratching something, and they give you a piece of paper, and you're thinking, how did you decide that I need this? And then I often don't take whatever they've prescribed. Like if something's going on and I don't want to just take medication. I want to know, well, why am I feeling this way? And when I took my daughter to you, she is lactose intolerant. We changed her diet. And when she met with you, we went through the extensive questions, and you asked her questions, and I found out stuff I didn't know about her trading lunches with people at school and stuff. But when it was whittled down to, let's eliminate dairy, that was really helpful, because I was starting to think that she had an anxiety disorder. She was having tummy aches before school, but that's right after she had eaten her breakfast. And so it's stuff like, you can think it's something and label it something else. And then all of a sudden it's like you take away dairy and none of the symptoms appear anymore. And you're like, oh, I'm so glad I didn't take any extreme measures. Now she can just live her life with lactose-free products. So I love that, because it's important to just look at why people are sick in the first place. So you mentioned virtual. Are you seeing anyone in person right
now? Yes, on occasion. So, one of the tools I use in practice is acupuncture. So obviously that has to be an in-person visit. So, but I would say that's mostly what I'm limiting in person to is, if they need a hands-on intervention, therapy, or, if there's an issue that requires, something to be looked at physically, if it's a skin rash or, a certain pain, then that's in person. But, I'm fortunate in that a lot of naturopathic care can be delivered just fine virtually. And then we have curbside pickup for, if it was herbal medicines or whatever the remedy. So it's a way to get it to people, minimizing contact and just sort of keeping the virus exposure to a minimum. So
now?
But it's a case-by-case basis. So we see the situation and certainly, you know, with
That was going to be my next question, was about your protocol. What kind of protocol have you put in place? So is it mostly curbside and?
curbside. You know, if there is an in-person visit, then the COVID screening questionnaire is sent out automatically
Mhm.
before the visit. So the person has to fill that in and answer no, of course. And of course, we both wear masks during the whole session.
Mhm.
And it's the enhanced disinfection protocols. So, you know, very similar to every other business, you know, venue. So.
Yeah. So for anyone listening to this who is stressed out, exhausted, what are some of the tasks and processes that you go through when you're assessing their situation?
Well, I would say by and large, it's mostly just, you know, the extensive interview. That's where I get most of my information. And I'm confident usually with what we discuss, you know, to make my recommendations. Certainly, you know, from a stress perspective, you can measure things like cortisol, for example, and either in a blood test, but you can also do what's called a 4-point cortisol, so saliva test, where you collect 4 saliva samples in a 24-hour period. And then you get 4 points on that curve, right? So you can see, you know, where's your curve. And more recently, there's been urine testing developed where, again, through 4 different urine collections in a 24-hour window, it looks at all the hormone metabolites that are being excreted. So it's actually what your body's producing and using, and kind of how much, you know, you're utilizing and going through, and which pathways and which metabolites are going. So it's a really interesting test that can tell a whole pile of information just about how things are working internally. So it's not just a one point in time, here's your level, but it's actually how things are flowing through the system. So that can be quite instructive. But it's not essential generally. It's, you know, I don't use those very often. They're great tools. They're, you know, they're kind of expensive though, which makes them a little less practical. But generally it's that interview. And because, you know, again, we have the luxury of time, I can really get a person's story, and then, you know, sort of figure out where the priority is, or where the, you know, the real stress points are, where the cause could be. So.
Awesome. Are there any general recommendations you can make for moms or dads heading into the fall, whether their children are going back to school or being homeschooled?
As far as like stress reduction, or?
I'm thinking more related to COVID and keeping healthy.
Yes, many. So a few are, you know, just getting outside, right? Just going for a walk outside, especially we still have a bit of summer left, is getting sun exposure, right, for vitamin D. But just fresh air and just the movement, and, you know, getting away from our screens. And especially if we can get into some green space where there's trees.
Yes.
Because there's been a lot of research, especially in Japan, with something called forest bathing, right? Which basically means going for a walk in the forest. So we're lucky in Kemptville, we've got the Ferguson Forest Center, for example. So a network of trails through a nice forested area. And, you know, this may be obvious, but we've tested it just to make sure. And when you take blood samples in people, and before and after, say, going for a walk in the forest, just an hour or two exposure to trees increases our natural killer cells, which is a type of immune system cell which helps our body fight viruses, and decreases our cortisol level, which is our stress hormone.
Wow.
And the effects last, not just that day, but they last for weeks after. Even like 2 consecutive days walking through a forest for a couple of hours, those results last. So getting outside as much as possible, I would say daily, ideally. And especially while it's still warm and sunny outside is key. I'd say number 2 to that is sleep, good quality sleep. So that going, making sure sleep is long enough and making sure the sleep quality is there. Poor sleep is associated with a 2.6 times increased risk of, say, developing upper respiratory symptoms from a viral infection. So more than double, right? If your sleep is too short or kind of below 80% efficient. And then I would say, well, it's been highly recognized that psychological stress can impair immunity, and especially fear. So in a pandemic, right, a lot of people feel anxiety and fear, and it doesn't help because everything is just bad news, bad news, bad news, and we sort of dwell on that. So just stress and fear can suppress our immune system, right? And so again, there's been studies with healthy subjects, and you evaluate how much stress they're under, and the subjects, and then they're exposed to cold or flu viruses, and then you wait a week and see who gets the symptoms. And so the people with the highest category of stress, again, were more than double the chances of actually having the symptoms.
Wow.
So respiratory symptoms, right? Viral respiratory symptoms. And this is interesting. Susceptibility to, again, viral infections of the respiratory tract, our susceptibility decreases with the more social ties we have. So the more socially integrated we are, the less chance we have of developing symptoms. And so the reverse is true. The people who are least socially integrated, or so whether that's actual or even if it's perceived, they just have the idea that they're isolated. It was a 4.2 times the chances of being sick than those who were, most socially integrated. So we're kind of at a conundrum here. Isolation suppresses immunity, yet, that's sort of the main thing that we're doing, right, to prevent viral transmission. So it's walking that line is how can we, maximize our social interaction or our connection, right? But of course, minimizing, the physical contact. So that's where, the semantics between physical distancing and social distancing, those are two very different things. We don't want a social distance. We want a physical distance.
That's tremendous.
So yeah, so that's, those are some key ones. So exercise outside, getting into some green space, sleep. And then of course, there's a whole other ad behind the scenes. So what we're talking about here is not, when we talk about an infectious illness, right, there's kind of two pieces to the equation. There's the virus or the germ, right? So we need exposure to a germ. But the other half is the susceptibility of the person. So what we call the terrain. So the germ needs to land in, right, enters the body, and is our body a hostile place for a germ, or is it a favorable place for a germ? So, right, we talked about psychological stressors playing an impact in our susceptibility, but then there's things like nutritional status, how's our vitamin D level, how's our vitamin A, different herbal medicines we know can activate certain parts of the system so that our cells, work faster, signal better, and we have a more rapid immune response. Fever, right? Honoring and managing fever properly, that's the number one defense for any infection. Fever is our friend. Yet in our society, fever is often feared and suppressed as quickly as possible. And so we've just thrown out the best part of our immune system, if that's the case. So knowing how to do that, and so this is something I've thought about a lot, and I'm very passionate about teaching people how to do this properly. And so then now you've got the best terrain that's hostile to the virus. So, but I think this is lost in our, right? So right now, most of the measures, right, we're doing is minimizing exposure. So yes, that's key, that's necessary. Mm-hmm. But we're not talking about, well, what can we actively do to improve, you know, our resiliency? So those are some of the key things, and there's many, many more. I mean, there's, we can, you know, we can do things. The research is there. We know that, you know, certain vitamins, minerals, plant medicines can help our immune system work, you know, to its highest capacity. So that's something I like to discuss with people, and certainly offer that.
That's very encouraging, because I find one of the worst things as a parent is to hear about this virus and then not have any action other than stay home, or, you know, don't allow your child to have a play date or whatever. When you know that there's actually something you can do, then you can take action to protect your children and yourself, which is awesome.
Well, that's right. So, I mean, it doesn't mean it guarantees, right? Nobody can guarantee that you won't, you know, you won't be infected, right? That's impossible. And despite our best measures for anyone, right, people will still fall sick, even if you're doing everything, you know, optimally. But there's a difference, you know, in people who are severely ill and mildly ill, right? They've got the same germ. So the germ part of the equation is the same, but it's what's the difference in the person who's in the intensive care unit and the person who doesn't feel anything or gets a mild sniffle, right? That's the terrain piece. So there's something about, right, those two individuals that's different enough. Their immune system is, you know, they're not equivalent. So the germ is the same, but the terrain is different. And so, you know, so my piece is trying to help people, you know, build that, you know, just build that immune response, you know, enhance that terrain. So, and yes, there's lots that can be actively done.
Awesome. Very happy to hear that.
Mm-hmm.
So we're heading into the fall, and everybody's talking about it, and it gets very stressful. What's the best way for families to increase their stress resilience? And like, do you have any rituals or habits that you would suggest that help with stress resilience with their children?
Sure. So I mentioned, you know, just going for a family walk outside, right? So that's just, you know, that does many things, right? Just relaxing. We get out of the environment. Something I've done and think everyone should do is, you know, ditch social media. I call it humanity's dumpster fire, right? It's terrible.
Yeah. Just
feeding fear and frenzy and stress. Try cutting it out for a week. It's awesome. Like, I only Facebook for organizing band practice, really, like, and just more and more I've pulled away completely, and it's great. And anytime I hazard a glance that way, you can just feel like, you can feel the stress. So I invite everyone to give it a try, and can almost guarantee you'll feel better. So that piece, obviously, you know, prioritizing sleep, right, for the whole family. That's going to have impacts on the immune system, on stress response, on just, right, sleep helps everything. Stress ruins everything. Sleep helps everything. So yeah, so just, you know, just decreasing that fear, right? And then if we can, you know, within our family bubbles or whatever, just much, you know, social interaction, because we know, right, that's actually shown scientifically to be protective from an immune perspective. And of course, you know, it's important for many other ways, right, to prevent depression, isolation. You know, I think I see a lot of isolation or people who lack support, and really that just opens the pit, and just makes everything worse, right? If we can have support, whether it's childcare or you know, just personal care, right? So I mean, a ritual for parents, you know, if you like massage, go for massage. You know, acupuncture can be fantastic for stress relief, for sleep promotion. So make those pretty, and don't feel bad about looking after yourself and carving out a little time to do that self-care.
Mm-hmm.
And sometimes it's just reading a book, and sometimes it's just saying no, right? I don't want to do this. I don't want to do that. You know, I mean, one thing I've heard, and you know, you've probably heard is, well, with this kind of forced time out that COVID's making us take, it's made a lot of people realize, you know, I didn't really like that hectic pace of life I was on. I didn't really realize it. And now that you're sort of forced to, you know, park the car for a bit, it's like, oh, I kind of like this, right? So that's obviously, that's not everybody's reaction, but a lot of people find it actually very restorative.
Yes.
It's the stop point. It's this realization to say, aha. So going forward, how can I maybe whittle away some of those obligations, right? That frenzied pace of life. And so I think, you know, that's an opportunity, right? And that's healing.
Yeah, I've heard that from many people who
Mm-hmm.
realized they didn't know they were stressed until they stopped. And then it was like, wow, I was really stressed. And
So
then,
then,
yeah,
yep. So hold on to that and don't let it slip away, right? So whatever sort of happens, you know, in the near future here, prioritize that, those boundaries, so that you can preserve that space. And I think that's going to have a huge benefit for many, many people.
yeah, including children who, you know,
Absolutely. Yep. Yep.
booked, you know, they go to school all day and then they're booked at night and on the weekends, and it's like, you know, just downtime.
Sure. So, right, it's that sort of over programming, right? So we've all been forced to stop, you know, the activities and whatever. And so, you know, maybe that's not a bad thing. And then, you know, as choices open up again, it might be, you know, worth it to be a little more selective and say, you know what, I don't want to be out every night hauling the kids around.
Yes.
And maybe they don't want to be either, right? It's tiring. It's tiring for everybody. And I mean, that, just that piece,
yeah.
you
Yeah.
know, is exhausting. And so, yeah, you know what? You don't have to be doing something every Saturday or Sunday or every night of the week.
Yes.
You know, you'll be fine. Kids will be fine. It's like,
Yeah.
just chilling out, reading a book is all right.
Yeah. Yeah. So anybody who is watching this and wants to come in and see you, what's the best way to book an appointment?
So they can look online. So my website is kemptvillenaturopathic.com. So there you'll have access to online booking, or you can give me a call, 613-897-1000, and I'm happy to chat. And yep, those are the two best ways.
Great. Well, I thank you for your time. I know you're a busy man, and I appreciate you giving us hope and some tips so that we can face this fall, just go in there confident in our abilities to stay healthy. Thank you so much.
That's right. Okay, thank you for the opportunity, Anne.